According to some medical experts, there seems to be a significant shift occurring in the field of healthcare in recent years, amidst a growing public perception that the industry is more treatment or symptom-oriented. There are a number of industry leaders with a crystal clear vision towards prevention.
It is more common than most people realize. 1 in 4 adults is affected by mental illness each year in the United States. Half of all Americans will have a mental illness in their lifetime, comprising a wide variety of conditions including depression, bipolar disorder, anxiety, eating disorders, and borderline personality disorder. Mental illness strikes people of all races, age, and socioeconomic backgrounds and is the leading cause of disability in the nation today.
Mental illness is a term we hear a lot. It's really what we refer to these days as psychiatric disorders or brain disorders, because we understand a whole lot more than we used to. These are biological conditions. They're highly heritable. They're very comparable to things like diabetes and heart disease. In this case, the organ that's affected is the brain. We know lots of words that are common in the mental illness category, things like autism in kids. In adults, major depressive disorder is very, very common. It's the most disabling condition of any medical condition in the world. Well, there's an enormous prevalence. About 1 in 5 Americans in a given year will experience a mental illness. And over a lifetime, it's almost 50%. It's very costly. It is the most costly category of any medical illness in the world, according to statistics from the National Institute of Mental Health.
Many people mistakenly associate mental illness with weakness or behavioral problems. In fact, mental illness is a medical disease just like cancer or diabetes and has the capacity to be helped or cured through medical treatment. Research shows that for 9 out of 10 people, treatment for mental illness is effective. Yet, a lack of access to quality treatment, along with the social stigma associated with mental illness, prevents many from receiving the help they so desperately need.
We know a lot about brain disorders, and we have really good treatments. We've got a lot of research, and we've demonstrated, and we know that treatment really works for these illnesses just as well as it works for lots of other medical illnesses. Trouble is, it's very often the case that people don't come for help. There's still a big stigma that surrounds mental illness. People are embarrassed and they're ashamed. They feel that's a sign of weakness. It's not clear to them that this is a brain disorder and it's a biological condition. So we really are working hard to try to counter that and help people get treatment.
At the time when I was diagnosed, there just wasn't the help I needed, and that really perpetuated kind of that stigma, and it perpetuated the fact that there weren't knowledgeable healthcare providers at the time in Houston, and so it just made me have to continue to live with my illness versus being able to manage it.
I think many people don't realize all that we have available and the progress that we have made in the past several decades in treating mental illness. People don't have an awareness of how much more we understand about the brain, how much more we understand about how stress affects the brain, and what we can do about it. That there are interventions that can make lasting differences for individuals, so they don't have to suffer in silence. They don't have to suffer with a sense of shame or a sense of weakness and inferiority around their difficulties, and that there's help available.
I'd say there are 2 problems. One is that there has been an image created by the old days of sanatoriums and electroshock therapy that has prevented people from really seeing this illness as any other physical illness. And then you have the second problem, there just aren't enough of these places around the country.
The Menninger Clinic in Houston, Texas understands that treatment works and saves lives. Founded in 1925, the Menninger name has become synonymous with landmark advances in the field of mental health treatment. At the Menninger Clinic, it is believed that a longer treatment period gives patients a chance to truly recover and a better opportunity to initiate lasting change. As a result, treatment stays at Menninger last 4 to 8 weeks as compared to 3 to 7 days in a typical acute mental health unit.
Many people have complex disorders, maybe depression, an underlying personality disorder, substance use on top of that. You need time to sort it out. We do believe that when patients have enough time, I tell families it's like learning a second language. You can't do it quickly, you have to work at it and you have to practice. But then you get to a place where you then can keep the benefits that you've gained, take them home with you, and stay better.
When I came to Menninger, I needed residential care. The outpatient treatment, something I had tried for years and it wasn't working for me. So it's definitely what I needed and what helped me. If I wasn't living here and immersed in the treatment, I wouldn't have seen the results and the success that I did. And of course, it changed my life. Menninger helped me understand what my illness was and how I could successfully manage it. And I think finally finding a place where doctors knew what they were doing, they knew how to provide the treatment I needed and knew how to teach me the tools I would need to continue treatment on my own, even when I left the clinic, just made a difference no one else had been able to make.
Statistics show mental health conditions are on the rise. The Menninger Clinic plans to stay abreast of the challenges that will pose and to continue to be the name that comes to mind when people consider mental health treatment.
They are in a very unique position to be the voice for, well, what I don't call patients, but I call them clients. You know, three of whom are our kids, and as a result, living fruitful, normal lives and pursuing their passions and their dreams. I think if Menninger can create a model, be a model for other cities like this, we might see some dramatic change.
The Menninger Clinic, advancing treatment, transforming lives. To find out more, please visit menningerclinic.com or call the number on your screen.